Good morning, everybody. I think we're going to go ahead and start now. Good morning. Welcome to the California Institute for Mental Health and the California Association of Local Mental Health and Boards Commissions training. This is a data training. My name is Kim Mayer, and I'm Associate Director for CiMH, and I'm very happy you're all here today. Today is a result of a lot of planning and collaboration with the Mental Health Planning Council, and I want to thank them for their support today. We have an interesting day, half-day planned for you, and what we're hoping today is that you walk away with a good idea in terms of some ideas about data evaluation and the data notebook, and for ideas that you can take back to your county and continue this work. We are videotaping this today because we know that there were many counties that weren't able to come, and so this will be videotaped. All the presentations will be edited into that, and it'll be on CiMH's website with a link, so other people can watch this too. So we're going to do a few welcomes here, and it's my pleasure to introduce you to Herbert Dubose, who is from the California Association of Local Mental Health Boards and Commissions. He also serves as, I'm sorry, that was Herman, excuse me. Herman serves as the Vice Chair of the LA County Mental Health Board, so welcome.
Thank you. Okay. I wasn't prepared. As she said, my name is Herman Dubose. I'm representing Carrie Martin, who is our first Vice President of the California Association of Local Mental Health Boards and Commissions, who have some physical difficulties today and why he's not here. And I was asked to welcome the group on his behalf and on behalf of the organization. And I'd like to say welcome. The other thing I'd like to say is that I'm hoping that everyone will take this workshop very seriously. As one whose profession is in the area of education and who try to do things based on evidence-based practices, and this is one time where we'll be looking at data, and I think data drives what it is that we can do. As I say to my students, policy dictates what we do and how we do what we do. So the emphasis of policy is driven by information, and not just anecdotal information, but information that we can test, retest, and hopefully get the same results. Those of you who did a little statistics, we talk about validity and reliability, and those are the issues that I am relating to. So I'm hoping that the information that we get today, that we will take back to our counties, take back to our boards, and say that we need this information to help us better develop policy which will benefit those individuals that we're trying to provide services to. So I am very happy to be here today. I've partnered with them over the phone in trying to get the questions and some other things organized. But the last thing I would like to leave with you, policy dictates what we do. How do we develop policy? We develop policy by having reliable and valid data to support what it is that we're trying to do. So once again, welcome on behalf of the California Association of Local Mental Health Boards and Commissions.
Great, thank you. Great way to start us off. Our next welcome is from Dick McConaughey, and that's pronounced like the actor's name, I was told. And Dick serves as the chair of the Orange County Mental Health Board, so welcome.
Thank you, and looks like we have some sun today. That's going to be a little breakthrough. We've had this kind of foggy weather, but welcome to Southern California, welcome to Orange County. Just a reminder, Orange County is huge. I moved here from the state of Washington. There are more people in this county than there is in the whole state of Washington. So the mental health issues for a large county, which is larger than Norway in terms of population, are tremendous. But also in my conversations with some of the less populated counties, other big problems there. One of the great things of these meetings is we come together, LA, Orange County, Shasta, Mendocino, Merced, all these different folks, and we share these different micro, macro perspectives, and to me, it's always exciting, and I always go back burbling, at least for a couple of days, to my board and say, oh, here's a new idea. Want to share briefly one idea with you today, OC Links. I've passed out a few cards to you. This is a brand new program, a great use of MHSA funding in our county. For years, some of us have grumbled a little bit about how do people access our, what turned out to be 192 mental health programs, or is it 196 now? It's still 192?
I believe it's still
Yeah.
192.
That's Mary Hale, the director of our BHS. And we kind of joke about that. How many programs do we have? And someday I'm going to give her a test. I'm going to say, within 15 minutes, can you write down the names of all your programs? And I bet you she won't be able to do it. So in a big county, but even in a small county, it's hard for people to access services. Where do you go? Your kid is flipping out, first incident, big incident. You don't want to call the police, so you get on the phone and you call your family doctor, who doesn't know how to refer into the county system, and says, well, talk to my friend, the psychiatrist. And you end up really being in a phone tag game and half the time never getting services. And we've become keenly aware of that in this county. We've had some good things going, warm line, hot line, and a number that kind of worked for people. Didn't cut it. And I have to thank Mary for spearheading this, but she and her team and also the citizen process of MHSA planning all work together to fund right now it's just a 5-day-a-week, 8 to 6. We're hoping to expand that as we get more money, because we know people freak out in the evenings too, or have problems in the evening, shall we say. But we have 4 clinically trained people who have worked in our system. We have Farsi and Spanish and also English covered in our staff. And there's a lot of hands-on referral, not just here's the number, call it. It's I'll put you through, I'll get in touch with, it's that sort of thing. One simple anecdote, which is a wonder to me, gal called in from out of state, got in touch with our OC Links, had lost her daughter, knew her daughter was in Orange County, probably on the streets, maybe had some idea of which streets or which arroyo the gal is inhabiting at this point in time. And OC Links got in touch with a team that goes out and reaches out to folks, located this gal who was off her meds, not functioning very well, got her medication, got her into treatment, and got back to the mom. Can you imagine, and particularly in a big county, that sort of loop taking place? And the mom was very thankful. Who knows how long it'll last, but at least the daughter was located and temporarily back into treatment. And again, that would honestly would never, unlikely to have happened without OC Links. So anyhow, I have a few green packets left. I noticed some of you picked them up already. That's great. And I'll have these with me for the rest of the day. Feel free to call our program manager inside and pick his brains, tell him you were at the meeting and they said he should share everything, and he will. He's up on it. So thank you very much. Welcome to Orange County. And this, frankly, programs like this would not be possible without the cooperation between our mental health board and our esteemed head of behavioral health services, Mary Hale.
Great.
Thank you. That was really informative. I appreciate that. I noticed, Herman, you said that data directs policy.
Yeah, go ahead. I'm
Data
sorry.
informs policy, And then policy has to be developed and has to be implemented, and that's where the mental health system comes in. Mary Hale serves as the director of Orange County Behavioral Health Services, and I think Orange County is the third largest county in the state.
Yes, yes.
And when you work in county mental health, I used to work for Contra Costa Mental Health, you think about that, whether the first or the eighth or the third or whatever. So it's my pleasure to have her to welcome us, and thank you, Mary.
Lady Brown knows really good.
Well, welcome. I'm so happy that you chose Irvine, a city in Orange County, as the place to hold your meeting this quarter. We really are happy to have you here. And I just wanted to briefly have a message to you this morning to really expand on what Dr. McConaughey was saying. I do think it is so important that as mental health boards or commissions, that as you do your work, that is so important in the state of California and locally at your county, as you do your job of advising boards of supervisors and local directors, that you do collaborate and you do work together with not just the director, but with the staff. And I just wanted to comment. I know certainly with our local mental health board, I know lots of you have probably moved to combined mental health and substance use disorder or behavioral health boards. We happen to be a behavioral health county, but still have separate boards. But just to really encourage that collaboration, that working together, and really just to take a moment to say what I'm sure so many of you know, that while sometimes it may seem like we come from a different place, I know that as a mental health board or commission member, you're doing it on a voluntary basis. Even if you're a member of the policy group or CiMH, where you're CiMH, of course, you're getting paid. County government, you're getting paid. But a reminder that whether you're an advocate not getting paid, a board member not getting paid, or a county staff member, we really all have the same passion and goal. Personally, I didn't start out in this field wanting to make a whole lot of money, thinking majoring in psychology I would make money. I started out wanting to help people, wanting to make a difference in the lives of people that had a mental illness. I ended up working a lot in substance use disorders. I didn't think that's what I was going to do, but I wanted to improve access to care. I wanted to make a difference in the lives of those people, even family members, because that's what I am, a family member. I'm sure lots of you are. And it's no different than the people that are on my mental health board. So our goals, our commitments, our passion is really the same. And it's really about improving quality of services for the individuals living with mental health issues, substance use issues, improving that access, like Dr. McConaughey talked about, OC links. And we can do it better together. As Herman said, policy dictates what we do, and data should drive that policy. Today, you're going to learn about some of that. But if you work together, you'll learn about the EQRO and all that data that the counties already have. So work together to see what they have. And from that, you can learn, what do they need to do better? What do we need to do better? How can we do it better? Do we need to get different data, better data? What can we change? How can we do it better? And it's become sort of a thing that we often say, we're better together. I keep saying it to so many different groups that I work with, but I really believe it. And I bet that a lot of you believe it too. And we don't have to be adversarial, the boards and commissions and the county staff, but neither do the other advocacy groups that we work with, whether it's NAMI or any of us. I don't have to list them all. You know who you are. But I just really wanted to come here and say that. I'm so glad that you're here learning about the data, evaluation, how we can use it better. But I want to encourage you, go back and work with your county director and their staff to make things better. And remember that we all have the same goal, whether it's assisted outpatient treatment in Mendocino County, and if the Mental Health Board and the MHSA stakeholders want that, and your Board of Supervisors do or don't, and your director does or doesn't, figure out what's that overall goal that folks are working towards, and start the conversation from there. What are the things that we do want together, and then see with the programs and with the data, can we find common ground? I hope today's training provides you with some of that information you need, or at least how to get there, remembering what Herman says, because I absolutely agree with that. But then try to be like Dick and I, work together, because I think that's how you'll make the best difference. Thank you.
Thanks for quoting that.
Thank you, Mary. That's a great way to get us going for the day. I appreciate that. The last person I'm going to introduce today is Jane Adcock, who serves as the Executive Officer of the California Mental Health Planning Council. And as you know, we've been working together collaboratively, putting this together for the last few months. I'm very pleased that Jane's here and can do a quick welcome. So thank you, Jane.
Good morning, everyone. Wow, I am really excited to see how many of you are here. I think there's somewhat upwards of 30 counties represented, because if I would have seen the title here about data and measuring outcomes, toss that. I mean, data just kind of makes my eyes glaze over. So I am excited to see so many of you here that are willing to spend the day on a Saturday to learn about how data can help you in your work. And I have to give a shout out to Mike Reiter. You're going to hear from him later today, looking at the reports that his organization produces in their EQRO reports. It's so clearly presented and easily to understand. You finally get how data can help you. And I want to take what Herman has talked one step further. I was taught several years ago that while data does drive policy, policy drives funding. So those three things work together, and that's how this becomes important to the work that you all do in making recommendations on how to use funding. What policies and programming does your county need to meet the unique needs of your community, and then where that funding should go. Lastly, I just want to tell you and share, I'm so amazed over and over again as I go around the state. I am so amazed at the meeting more and more committed people with a passion for the work that they do in mental health. And when Dr. McConaughey said Mary would be able to list all 92 of the programs, my thought in my head was, I can't even remember the 7 dwarfs. So, you know, I applaud all of you for your commitment, your passion, and your stick-to-itness in making a better world and helping folks that we love and care about to recover from mental illness. So thank you for being here today. Know that the Planning Council is a partner with you in the work that you're doing, and in any way that we can assist, provide technical assistance, and certainly to help spread the word and work with you in completing your data notebooks, we're here to help. And don't hesitate to contact us. Thank you.
Yeah, Marv is a nice guy to work with, and we enjoy. Can you really name all 92 programs?
I doubt it. Thanks, Mary. Great. Okay, so great. So we're going to have our first presentation. And just to sort of lay out the day for you today, we're going to, in the morning, sort of introduce some overall concepts around data and program evaluation, which my colleague Cricket Mitchell is going to do. We're going to then introduce the data notebook. We're going to have lunch, and you may want to choose to maybe talk in your regions or not, but to kind of share some information. And then this afternoon, we're going to hear some from Mike Reiter from APS Healthcare in terms of talking about the EQRO, or External Quality Review Organization process, and what that work does and how that plays into our work today.